Welcome back to another episode of Biohacking with Brittany, where I explore cutting-edge methods to enhance our health and well-being. I am your host, Brittany Ford, and I am just thrilled that you are joining me today. This episode was really interesting. It is all about vestibular health. That is not something I have ever covered before on this show. I was joined by Dr. Madison Oak, and man, did I learn a lot from this. So we talk about things like dizziness, vertigo, headaches, understanding migraines in pregnancy, postpartum, hormonal fluctuations in relation to that, medication versus holistic approaches to all of these issues. I talk about, the experience that I had seeing my dad go through vertigo for a while and what caused that and how he kind of healed from it. And yeah, it was really interesting to kind of learn about this whole issue that people deal with in terms of dizziness and vertigo and like how you can kind of heal from it. It's not something that I have personally really ever been through. So it was awesome to just learn from Dr. Madison and just hear how she is really able to help patients and help people in this space. And also it's actually very common. And we also talk about my husband who gets headaches / migraines and like, what is the difference between that? And what is the root cause? What is the issue? And that was so fascinating. And after I recorded this episode, I actually went and spoke to him and I, I repeated all of the information and said, look, like this is what I think is happening here. And this is what we can do to kind of mitigate it so that you don't get those migraines again. And it's been very helpful. Like it's been very helpful since this episode, since I did the recording. Like, I don't think he's had one. Oh no, I think he had one. And that was because, I was using moxibustion. If you know what moxibustion is, it's basically a very strong, like incense. And I used it in the house and I shouldn't have done that. And that triggered one for him. So anyway, it was interesting to see how badly he reacted to the smell of it and how it triggered a migraine for him. But other than that, it's been really great. It's been really great since I did this episode. Yeah, and I'm not going to give anything away. You obviously have to listen to the episode to find out about the root causes of headaches and migraines and things like that. But trust me, I took this advice, applied it to my husband, and he's been doing great so far. We talk about dizziness during postpartum as well, and like how and why that might happen and why that's even a thing, which I didn't really know was a thing. So it was definitely eye-opening. Before we hop into this episode, let's do DM of the day. This is from a fellow follower on Instagram. You are always welcome to message me. Even if I take a couple days to respond, like I do respond. And it's me. It's not anybody else. It's actually me responding. So this person writes, "Hey, Brittany, I'm so inspired by how you've used biohacking to manage your own health challenges. I'm particularly interested in how biohacking can aid women's hormonal balance. Do you have any advice on starting points for someone looking to use biohacking for hormone regulation? Your insights would be incredibly helpful." So thank you for writing in, this person. We keep everybody anonymous when they do this. Yes, absolutely. I have talked about balancing hormones many times on the show and on social media. So please go down the rabbit hole of my content and you can find all sorts of answers. A great place to start if you're looking for something more concrete would be to download my Biohack Your Cycle guide. This is really great. Oh, it's not even called that. Sorry. That's what it used to be called. It's called my Ebb and Flow Cycle Guide. Oh my gosh. That's funny. Yeah, it's called my Ebb and Flow Cycle Guide. And this is all about balancing your hormones, cycle syncing, regulating your menstrual cycle through biohacking in natural ways. I found it really interesting when I was creating this to break down the different phases of the menstrual cycle and think about how we can optimize each phase, the luteal, follicular, ovulatory, and menstrual phase. So if you want to balance your hormones, there are actually things you can do during each phase to kind of help each phase, right? So things above and beyond just eating a certain way. Things like supplements, like your workout routine, how you're sleeping, the stress management. There's a bunch of other like holistic therapies that I have in there that are really geared towards those different phases. So that's kind of where I would start. It's a PDF, like it's a guide. It's an online guide. So you just download it off my website. I will link it in the show notes so you can grab that. And then depends, although you didn't say this, kind of depends what you're looking for. If you are looking for like fertility, preconception health, obviously you can enroll and join my course, my Baby Steps course, which is really popular and is very much about hormonal balance, optimizing our health before we get pregnant. That is like, there is so much meat and potatoes in that course. Like I couldn't even do it justice if I were to like do an episode on it. There's so much content in there, all about things that you can do to optimize your health, from nutrition to supplements to red light therapy, hot and cold therapy, castor oil packs, yoni steaming, like all of these things that we can do to really optimize women's health, essentially. So that's always available to you. And you can go and join our group. We have a lovely group of women over there. And yeah, that's kind of what I would suggest if you're looking for really concrete places to start that have a lot of content. I also have podcast episodes. You could just search online for the different episodes about hormonal balance as well. This is like a very general question. If you have more specific things you're looking for, just let me know. And before we dive in, a shout out to Qualia Life. I love using Qualia. So they create this product called, it's a senolytic, Qualia senolytic, I think it's what it's called. And essentially, listen to my brain these days. Essentially, it helps with senescent cells. So senescent cells are really interesting because they are actually one of the 12 hallmarks of aging. So I think we went from 9 hallmarks to 12 or maybe 11. I think it's 12. And senescent cells is one of those. So senescent cells are these like sluggish old cells that we kind of want to clean up and get out the way so that there's space and we can create new, healthier, stronger cells. And the question becomes, how do we do that? And what we can do is we can take something like Qualia Senolytic, which is designed to help that process specifically. Like it's very, very targeted for that. It's got things like fisetin in it, quercetin. And the best part is you only have to take it 2 days out of the month. So if you're someone like me who cares about longevity, even at this point in life, no matter what age you are, you don't want to, age faster, get sick faster. You want to extend your health span, not just your lifespan. Senescent cells should definitely be on your radar. And then Qualia Senolytic is designed to help that process specifically from Qualia. Use my discount code biohackingbrittany. Oh, sorry. Actually, I think it's just Brittany in all capitals. And you get a really, really nice discount with them. It's not the cheapest supplement or stack to start. So you definitely want to use discounts if you can. And then a shout out to Bioptimizers. They are doing free magnesium this summer and you are running out of time. So if it is August still while you are listening to this episode, go and get your free bottle of magnesium today, right now. So go to the link in my show notes and you can do that. That is the only place that you can get a free bottle of magnesium. It has all 7 types in it. Isn't that crazy? So you don't have to worry about, I need this biglycinate or this chelate, whatever it might be for this specific issue. It has all 7 types in there so that you don't actually have to worry about that. You don't have to think about that. You can get full spectrum magnesium to help with sleep, stress, mood, sore muscles, energy, irritability, whatever it might be. I take 1 at night right now, and then sometimes 1 in the morning, depends how I'm feeling. But listen, like I have my entire family on magnesium. Like everybody's on magnesium. I don't know anybody who's not on magnesium in my life. So check that out. Again, you can only get the free bottle through the link in my show notes. And so that's kind of what I would do. If you're listening to this and you're like, oh man, I want that link, but I'm not good at using show notes, or I don't know how to do that on Spotify or Apple Podcasts or wherever you're listening, just send me a message on Instagram and I'll send it to you. Okay. Enjoy this podcast episode. Thank you for listening, and I will catch you soon for another one. Welcome to Biohacking with Brittany. Thank you for tuning in to today's episode. This episode is going to be super interesting as this is a topic that I know very little about in the health and wellness space. We are talking about vestibular health, dizziness, vertigo, everything related to disorders in that realm, and holistic approaches to really managing these conditions. So joining me, I have Dr. Madison Oak. She is a dedicated physical therapist and she specializes in this space. She is the esteemed founder of Vestibular Group Fit and Oak Physical Therapy and Wellness. So, Dr. Madison, welcome to the show.
Thank you so much for having me. I'm excited to do this today.
Yeah. How did you first get into vestibular health? Like what was that journey like for you? I feel like that's such an interesting place to specialize.
Yeah, definitely. It's a kind of a longer story, but the short of it is that in physical therapy school, I went to the University of Wisconsin at Madison, and they have an excellent physical therapy program. And the woman who basically wrote the book on what needs to be in a neurological physical therapy practice was our neurology professor. And so she really hounded us on the fact that we truly need to understand what the vestibular system is, what's going on with it from at least a basic student level. From there, I went to this clinic in Austin, Texas called, at the time, it was 360 Balance and Hearing, I think. I think it's now Balance and Dizziness, but a great clinic. And they only take students from University of Wisconsin and Texas Women's University down in Texas. And so I went there just because I had free housing in Austin, honestly, and thought, okay, well, at least I will live for free because these are not, you don't get paid on these rotations. And all I did all day, every day for 9 or 10 weeks was vestibular care. And at the time, you could ask anyone in my class and they're like, oh, no, Madison's going to be an inpatient physical therapist who's going to work with only pediatric patients, only kids in hospitals. And then I graduated. It was the pandemic and I got a job in a clinic in New York City after my very last clinical at a place that did partially vestibular care and partially orthopedics care. And kind of as that came along, everyone who's a physical therapist, not everyone, but many physical therapists can treat acute dizziness and vertigo. So your inner ear viral infections, benign paroxysmal positional vertigo, which is a crystal problem, most physical therapists can treat those. But the chronic patients, they're like, oh, we'll send them to the new grad and hope she knows what to do. So but all my patients were getting worse. And I was like, okay, I don't know what's happening here, but like, I'm going to basically put you all on pause for like the next 3 or 4 weeks until I can figure out what's actually going on here. Like, I need to like dive into the research. I don't know what's going on. And I'm the first to admit that like a normal physical therapy education from school is not enough to treat the chronic dizziness patients. I really dove into the research and I discovered something called vestibular migraine. And I'm like, at this point, I am pretty sure all of you have vestibular migraine. It turns out vestibular migraine affects over 3% of the entire adult population, which is a massive number. And so all of these people are coming to me with this migraine problem without the headache in kind of like this 18 to 60-year-old mainly age demographic. And all of these people have a history of migraine, well, most of them, that has now changed into vestibular migraine, which has then triggered persistent postural perceptual dizziness, which I explain as sort of the chronic pain of dizziness, where you're having these symptoms all the time. They don't really like go away, but they'll kind of wax and wane during the day and no one can figure out what's wrong with you. And so I figured out in my clinic what was making these people better, which was like more of a holistic plan of care rather than these head shaking exercises that are traditionally prescribed for dizziness, which we can kind of get more into. But that is how I founded Vestibular Group Fit, which is basically the way that I would treat someone in a one-on-one clinic, but way more cost-effective and affordable option that is available internationally, because technically you can only practice one-on-one in states you're licensed, and people all over the world are managing and trying to deal with dizziness that they don't know what's going on with them. So that's sort of the story. I absolutely am obsessed with it. I have tons of free resources and paid resources, but yeah, it's been great.
Yeah, that's so interesting. Just kind of like the cascade of like the conditions that can happen there that you were explaining. But before we kind of get into specifics, like for listeners who might not be familiar, can you explain what vestibular disorders are and how they can kind of affect individuals?
Absolutely. Yeah. So you don't normally know you have a vestibular system until something goes wrong. Like I will have most of my patients, I'm like, okay, the first thing we're going to do is explain what it is and where it is. So we can kind of do that now. Now, if you Google a picture of vestibular system, what's going to pop up generally is a picture of your outer, middle, and inner ear. So we're going to start with the outer ear because all of this anatomy is important to kind of how it works. Your outer ear is the part you can touch. It's on the side of your head. You can stick your finger in your ear canal, even though I don't recommend that. You shouldn't. All the way until your eardrum is considered your outer ear. It's designed so that you can hear us talk right now, and it will basically funnel vibrations towards your eardrum, which then delineates the line between outer ear and middle ear. Your middle ear is the part that pops on an airplane or when you yawn and you're like, oh, like my ear popped, or maybe it feels full when you're sick, things like that. Now, that is intended to basically regulate the inner ear pressure of your middle and inner ear. So if you Google it, it's the part that looks like the coast off of Florida, and it kind of sticks down right there. It connects your ear to the back of your throat, basically. And again, it kind of regulates that pressure. It's closed at baseline. When you feel it pop, it opens and shuts again, kind of letting in or out air. Now, within that space, you also have your malleus, incus, and stapes, which are the three tiny, tiny, tiny little bones in your body that connect your eardrum to your inner ear. Now, in high school biology class, you probably learned about your cochlea, which is your hearing organ. It looks like a snail in your inner ear. Those kind of teeny tiny bones connect to your cochlea, and they send the vibrations like you're hearing right now to your inner ear in the cochlea part to say, okay, I can hear this. I'm going to then send that signal to my brain, and it's going to make the words that you're hearing right now. Attached to that is your vestibular system. Now, this is the part that they forget to teach you about in high school biology class. Or if they did teach it to you, you promptly, you didn't, but most people promptly forget about that part. And it's basically three semicircular canals. Now, you can Google a quick image of this. You'll see it. And it's three canals. You have an anterior one, it sticks forwards and up. You have a posterior one, sticks down and back. And you have a horizontal one, sticks to the side. And these three semicircular canals are exactly that. They're partial circles and they have fluid in them. And they move back and forth and they hit this thing called the ampulla, which there's all these ridiculous words for all these things, but that helps you stabilize your gaze, for example. So if you shake your head right and left, but you can stare straight forward, that's your inner ear, making sure that your eyes stay stable. It's called gaze stability. Now, the other part of your vestibular system that's important is your otolith organs. They're called your utricle and your saccule. There will not be a quiz, I swear. But they look like have you seen those new candy? It's like Nerds candy. They're like Nerds stuck to Nerds rope, but they're like cut up in pieces. It basically looks like that. And it basically is like sesame seeds or Nerds stuck to like a jelly layer, and then there's hair cells beneath, and those detect linear motion. So your semicircular canals detect all angular motion, and your utricle and saccule, your otolith organs detect linear motion. They send the signal to your brain. I know this is very convoluted. They send your signal to your brain and they say, this is where your head is in space. And that is how you know, eyes open or eyes closed. I mean, your neck has to do with this as well, but where you are in space. If you close your eyes and you're in a car, you can feel yourself accelerating and decelerating. That is your inner ear. Another more kind of simple way to look at this is if you still have a cable TV with a cable box. The cable box is your vestibular system. The cord is your vestibular cochlear nerve where they kind of send that signal. And then your brain is the television that makes up a picture so you can see or feel where you are in space.
Yeah, that's a great analogy, actually, to just kind of like wrap it up. But yeah, I think that's really helpful for all of the nerdy people out there who are like, I want to know the biology behind this. But it's also just great to like learn about it, like, because like you said, in biology class, like we don't learn about that. We don't learn about these things like as in depth. What are some of the common kind of like misconceptions that you see about vestibular disorders and their symptoms, like maybe when you talk to friends or family or even in your practice?
Absolutely. The biggest one is that dizziness just shouldn't be that disruptive in your life. And this other biggest one is that it's just anxiety. It's made up in your head, these kinds of things. And these are things that I see from my patients that doctors have told them, that family members have told them, that their bosses have told them, their partners, all of these things. It's just in your head. You're just having anxiety. Just like stress less. Get over yourself. you're just dehydrated, all of these things. But in reality, you can have a vestibular disorder in your inner ear, or you can have a vestibular disorder in your brain. And these two things are treated very differently, but it's never anxiety. Now, does dizziness automatically trigger anxiety in your brain? 100% it does. It's terrifying. No one likes to be dizzy, but it's not the anxiety that usually originally triggered it. And so people will go to over 85 doctors before they finally figure out what's actually going on with them, which is so, so interesting. But the most common misconception for sure is that it's just anxiety. It's just in your head. You need to stop stressing out, maybe quit your job.
Wow. Why do you think that people have that misconception?
Yeah, that's a great question. So dizziness generally is not taught in medical school. So when you go to med school, and I have a lot of good friends who are excellent doctors, right? Like we know them, we love them, but at the exact same time, you can ask them, what did you learn about dizziness and vertigo in school? They'll be like, oh, if you're dizzy, the diagnosis is vertigo. It's probably BPPV, and they need to do a maneuver to reorient their crystals. I think that's what they'll tell you. And a lot of times it's not that. Or they'll tell you, oh, it's just anxiety and the person needs to stress less. And it's truly not taught because most people are not interested in it, because it is diffuse. It is kind of complex until you really learn the nitty gritty about it. But a lot of people are just like, it's confusing because this person could have a brain tumor. This person could have something incredibly benign. And differentiating between that, you really need to like have a good relationship with your patient, because they need to tell you what they exactly feel like, what those symptoms exactly are. Between, I have a hot air balloon in my head, like people have told me My Little Pony's dancing around in my brain, or the room is spinning around me. And those really do differentiate well, but from diagnosis to diagnosis. So a lot of people just don't like to treat it because they don't fully understand it. And it is something that if you're going to treat it, you probably should, or I guess should dedicate most, if not all of your practice to it, because it is so common and it can be really complex for a lot of people.
Have you heard about senolytics yet? It's a class of ingredients discovered less than 10 years ago, and they're being called the biggest discovery of our time for promoting healthy aging and enhancing your physical prime. Your life goals in your career and beyond require productivity, let's be honest. The aging process, however, is not our friend when it comes to endless energy and productivity, and that's why I use Qualia Senolytic. If someone had told me that there are science-backed ingredients that could help me feel 15 years younger in a matter of months, I would not have believed it until I tried this. As we age, everyone accumulates these senescent cells in our bodies. They're also kind of known as zombie cells. They are old and worn out and not serving a useful function for our health anymore, but they're taking up space and nutrients from our healthy cells. Much like getting rid of dead leaves off of a plant, Qualia Senolytic removes those worn out senescent cells to allow for the rest of them to thrive in the body. The best part is you actually only need to take it 2 days a month. When I have taken this, I've had higher energy levels. I have been more productive, felt more enthusiastic in life, and also had less aches and pains. So resist aging at the cellular level. Try Qualia Senolytic right now. Go to qualialife.com/Brittany for up to 50% off, which is wild. And use code Brittany at checkout for an additional 15% off. That's Qualia, spelled Qualia, life.com/Brittany for an extra 15% off of your purchase. Thanks to Qualia for sponsoring today's episode, and I will definitely be taking my share this month. Yeah, it definitely sounds like it. So, just on the topic of dizziness itself, it sounds like it's quite a common thing. And, I would argue most people have probably been dizzy at one point in their life. Like I definitely have. So, I know what the feeling is like. Why do people develop dizziness? Like, I'm sure there's multiple pathways, but what are kind of the most common root causes of the dizziness in the first place?
That's a great question. So I want to remind everyone that both dizziness and vertigo are symptoms and never a diagnosis. So if you've been diagnosed with vertigo, please find a new doctor. It's not a diagnosis. So that's first and foremost. Now, there are two kind of buckets that we can separate these diagnoses into. The first bucket is peripheral disorders, and the most common of those being benign paroxysmal positional vertigo, which is incredibly benign and very easy to treat. It can cause kind of other things down the road like triple PD, but generally, if you get BPPV, you do this thing called the Epley maneuver or a barbecue roll, which again, silly names for these things, but they do work and they will reorient your crystals from the semicircular canals we talked about into the otolith organs and everything goes away. The other most common one is called vestibular neuritis. And that is what we just determine to be called a hypofunction. So it's a viral infection in your inner ear that can pop up at any time. And it attacks the inner ear nerve, leaving you with less function on one side than the other side. It will cause gaze instability. You will be dizzy for 24 to 72 hours, and then slowly it will improve with time. So that is a great kind of thing to look at it that way, because you can do vestibular rehab, these head shaking exercises, and it typically goes very, very, very well. Now, when we talk about the central disorders, these are disorders that are happening in your brain and spinal cord. The most common form of neurological dizziness and vertigo, and this is what I mostly treat, is vestibular migraine. Now, this is a migraine disorder. It comes in the exact same bucket as ocular migraine or painful migraine or hemiplegic migraine, also is vestibular migraine. Again, it's the exact same disease process. However, it presents differently. And classically, we've all been taught that migraine is a headache with light sensitivity, and maybe your mom or your sister or your friend needed to go lie down in bed for a day or so, and then the attack goes away, or they take a certain medication and the attack goes away. It's always classified as head pain. But for vestibular migraine, the central disorder, you do not need the head pain in order to have a vestibular migraine diagnosis. And so this one really goes underdiagnosed because people are like, well, I don't have a headache. I can't possibly have vestibular migraine. But that's not actually the truth. Then the second thing that we most often think about and talk about is persistent postural perceptual dizziness, which again is sort of that chronic pain version of dizziness, if that makes sense. Those are the four most common ones. No, those are just the four most common. Yeah,
okay. Yeah, that's really interesting. I don't have a lot of experience with like vertigo, but I remember a while ago, this was probably like 10 years ago or so. My dad was, maybe it was more than that. My dad was in the pool with my little brother and they were like wrestling or something like that. And my little brother jumped and something happened where his foot landed on my dad's ear somehow. I don't know. And my dad freaked out and he was in so much pain. And, from that point, his doctor said, I think you have vertigo from this because I guess of the symptoms that he was dealing with. Now, I don't know how he went about healing it. This was a long time ago. I just remember that happening. So is that like a common thing where like there's some sort of like injury to the ear, like a blow to the ear, if like a foot were to cup the ear and like mess up the tubes like that? Like, is that common that you see?
So it's common in the concussion world. And I do treat some concussion. I'm certified to treat concussion, all the things. It's definitely not what I see most, but I have seen people who they've had a blow to the head from a baseball, from a kick, from things kind of like you're mentioning. And that can cause dizziness and vertigo from the concussion. That's another way you can get a hypofunction, kind of like we talked about with the viral infection, from a lot of different places. So over time, if you move your head and keep exercising, move your body around, kind of just do your normal day-to-day life, it can compensate on its own a lot of the times. And so that would be my best guess. But again, I wouldn't know unless I, of course, like he was my patient, right? Yeah, that would be my best guess.
Yeah. No, that makes sense. That's kind of what I was figuring as well. I know something that, you talk about as well is like these symptoms and these health conditions affecting women. And I want to talk about that because I have a large part of my audience is female. And, whether it's pregnancy or postpartum or menopause, how does things like dizziness or migraines like show up differently for women than maybe what you see in your men in your practice?
Absolutely. There are far more women who have migraine than men. That's just across the board, just generally. And we do believe it is something hormonal. And it's a big number of people. So about some, there's different kind of like ratios, right? But they say it's about 3-to-1 female to male ratio of migraine. So it's a much larger population of women than it is for men. So we'll start there. It is also most common in women of kind of like their most, they would call like the most productive, like childbearing years. So like 18 to in your like 40s, 50s. That's when this most common is the worst, which is so frustrating because you're like, I have built my career. I'm going to school. I'm working. I have kids, all of these things. And then migraine is there at the same time, which can be absolutely massively debilitating. And that's really frustrating for, I'm sure, as you can see, a lot of reasons. Now, this is, again, really common. And we do think that we know that there's a hormonal component. Now, for some people, it will start at birth, like colicky babies who have stomach issues as you're in your adolescence. If you're having like chronic stomach aches, things like that, that can be kind of representative of childhood migraine. And my best friend as a kid went through that. And we had no idea until she started developing more head pain. And they were like, oh my God, this was migraine all along. So things to look out for in kids. Then as you kind of start your period, you start having a cycle, things like that. Then estrogen, progesterone, all of these hormones are happening, right? They're fluctuating through the month, through the week, through the day, honestly. And all of those things can impact migraine. Now, a lot of people and a lot of doctors, frankly, will tell people when the day you hit menopause, all your symptoms are going to go away, right? Like menopause is a 1-day occurrence, and then you're either pre or post, right? If you're in post-menopause, all your symptoms are going to go away because you're a woman and your estrogen is fluctuating, and that's the problem. That actually doesn't happen for most people. Symptoms will maybe change or grow or be different than before. And for a lot of my patients, they will have had classic painful migraine in the past, although again, that's not a requirement, but a lot of them will. And then they will go through menopause, or they'll have their first baby or second or third. And from migraine, it will change, or I should say classic, like painful migraine, it will change into vestibular migraine for reasons that we do not understand at this time. And there's not enough research and things like that. So it's an interesting thing to look at because people will get more symptoms during ovulation and right before their period, or they'll be like, I can get dizzier right before my period, and then my period comes and I feel better. Some people that's not the case for. There's an argument to say that it is because when you have migraine, your estrogen, which drops right before your period, will drop further and faster for people with migraine than people without. Now, that being said, I also see people who are not properly detoxing their estrogen. So they're making all this estrogen, but maybe you're not pooping, maybe you're not hydrated, maybe your liver isn't like being supported properly, things like that we talk about a lot. Maybe you're not sweating enough. All these detox pathways matter because that's how you excrete estrogen. Now, I am by no means like a hormone specialist, but from the ones who I work with and talk to, a lot of them say, well, now you have this estrogen buildup right before your period. It's supposed to drop down, but you're not detoxing it. Then you're starting to make more, and now your body's overloaded. This especially is true with people who are constipated kind of around their cycle. So this can be kind of, you need to look at it in both ways. And so some people will be like, well, I'm going on birth control. I'm going to start HRT or things of that nature, which can be really helpful for some people. But if you have too much hormone and then you add more hormone, oftentimes you're going to feel worse. So it really is this delicate balance, and really figuring out with a good, like kind of hormone specialist type of doctor, whether that's an OBGYN who really understands, or a naturopathic doctor, or a functional medicine doctor, like whoever that is for you is going to be really important because, again, this is more common in women. There is a hormonal component. It's not just hormones, right? If it was just hormones, I think we'd probably all have this figured out by now. But there is a component of that can trigger symptoms to be worse.
Yeah, that makes a lot of sense, especially just thinking about the certain times that it could be worse. Like ovulation, we have the peak, and then, your period, you have the drop off. And then also even just with like pregnancy and postpartum, like, do you have women who are pregnant who come to you with like, obviously hormones are just so, extreme during those 9 months? Like, what do you kind of see there? Is it the same like dizziness and vertigo, or like what migraines, like what's common?
That is a great question. So there's one study I saw that said over 50% of pregnant women have experienced dizziness during their pregnancy. Now, whether or not that's vestibular related, who's to really say, right? Like you might have different blood pressure changes, or maybe you have blood volume changes. Maybe you aren't hydrated enough, right? There's so many changes that happen when you go through pregnancy, as you know, right? So that can be a piece of it. However, a lot of times, so we think of pregnancy in trimesters. The first trimester, your hormones are going crazy, right? They're rising, they're falling, like there's all these different changes. Then at the second trimester and third, estrogen just rises and rises and rises and rises and just gets higher and higher and higher, right? And that makes most people feel so much better. I actually had a patient come to me the other day who's like, my doctor just told me to get pregnant and that like all my problems would go away. And I was like, who is this doctor? Because that is not true. And she's like, well, I do want to start a family. I'm like, don't let me stop you from starting a family. Like, I think that's fantastic, but like, don't go into this thinking that this is going to solve all of your problems. And I'm like, okay, we need to like take a couple steps back here. Again, first trimester, things are really wild. Second and third, estrogen climbs. People tend to feel a lot better during that second and third trimester. Some people feel better the entire time, but I would say overwhelmingly trimesters 2 and 3 are better than 1 from what we see clinically. Now, what happens when people give birth, right? That is the single biggest drop in hormones that a human being can experience, right? Like there is no bigger hormonal change than the second you give birth, right? So what do you do then? If you are a person who's pregnant and you have migraine, you have vestibular migraine, like you really need to kind of lay down a plan with your OB and with your neurologist, if this is something you've already been dealing with, about what you're going to do after. Now, this could change kind of what it looks like for like your birthing plan. This might change what it looks like for your breastfeeding plan, for your sleep schedule. Like all of these things are really important from a comprehensive outlook of how we treat migraine and vestibular migraine and other vestibular disorders, but mainly with hormones. Like that's what we're kind of looking at and talking about. It's really important to know off the bat, like, am I going to do? Am I going to sleep train my baby? Which like, I know there's like debates about that and things, but what is best kind of for my health as a mom, right? And what is best for my hormone health and kind of how can I work on that is all really, really important.
If you're feeling out of sync with your hormones or struggling with fertility, I totally get it. I've been there and it can be so frustrating, but I found a delicious way to support your reproductive health. I have developed hormone balancing, fertility boosting chocolate. This isn't just any type of chocolate. It's packed with adaptogens like maca root and antioxidants from cacao and pomegranate. These ingredients can help regulate your hormones and support your preconception health and fertility. You need to download this recipe ASAP, okay? Because it's more than just a treat. It's a powerful way to nourish your body from the inside out. Imagine indulging in a rich, delicious chocolate that not only satisfies your sweet tooth, but also boosts your wellness. Whether you're trying to conceive, balance your hormones, or just crave a healthy indulgence that you get to make from home, where you get to control all of the ingredients and also optimize your health, this recipe is perfect for you. Don't miss out on this tasty, fertility enhancing, optimizing health solution. You can go to biohackingbrittany.com/pages/fertility-chocolate and download the recipe for free right now. Go for it. It's just right there waiting for you. It's linked in my show notes. It's linked on my website. You're going to find it super, super easy. So treat yourself to better health, one delicious bite at a time. Yeah, I think you're spot on. And I think it's hard because like pregnancy, you're already going through so much. And then to try and like think about this layer as well, if you're somebody who's prone to these symptoms and are prone to these conditions, and then you're like, okay, great. Like I feel better during second and third trimester, but now I have birth coming. And like you said, like what a change within minutes or hours, whatever, of the birth happening, right? And then you're in postpartum with a new baby, and now your symptoms and your dizziness, your vertigo, migraines, whatever is back. Like I just couldn't imagine even trying to like, what do you do? Like, where do you turn? And like you said, like you have to kind of have a plan and be more preventative and proactive about it so that you can kind of avoid this postpartum dizziness or vestibular disorders that can kind of come up through that phase. Do you see that it kind of, maybe after the first year postpartum, things kind of ease down again, typically?
It really is so person dependent. So when we think about treating vestibular disorders, I know we've talked a lot about hormones, right? But we need to think about exercise. We need to think about sleep, relaxation, stress management, meditation, breath work, diet, hydration. Like there are 1.5 million things that I have to have my patients think about. And I have them start, if they are pregnant, way before they give birth, right? On the diet, which I mean, we all know you need to be drinking more water and eating good food and balancing your blood sugar and all of the things already, but those are hard things to do. So I really work with both my one-on-one patients as well as with my group, Vestibular Group Fit members on how to do that. Now, if they're pregnant, we want to be thinking about like in that year where things hopefully are starting to level out, like, do you need help? Does your body need support in that? Dietitians, some like functional doctors who are, I tend towards the ones, I mean, everyone has a favorite, but I tend towards the one who have like medical training as an MD or a DO and then kind of have like a functional background on top of them. And within them, I'm still pretty picky. But those kinds of people who can look at you from like a whole picture perspective are most helpful. And we go over all of this in group as well. But basically, you want to be looking at all of these different pieces of your pie, of your puzzle, and really putting them together. So within that first year, like things typically they should level out, right? But maybe you have a mineral deficiency that's really kind of making things more difficult. Maybe there are other things that you might not have looked at, cortisol levels, sleep, whatever. And everyone knows in the first year, you're probably not sleeping too well. And so how do you prioritize maybe the other things on top of sleeping, right? That might be more easier for you to manage than sleep. So kind of thinking about it that way almost. And also knowing that like these things do improve when you are given the right tools, when you are given the right support, but you can't just say like, okay, I'm going to give birth. I'm going to like, just like really suck it up for a year. And then after a year, it's going to get better because that's when kind of triple PD and other things can trickle in. So unmanaged vestibular disorders, when there is fear of the symptom or anxiety about the symptom and other like inflammatory conditions and things like that, which we know like pregnancy and postpartum, lack of sleep, all of those things can make worse. That can kind of drive persistent postural perceptual dizziness, which is this background dizziness symptom. So it is really confusing and it can be really complex, but also like kind of the whole premise of your podcast, right? Is like, what are the things that we can do to better ourselves, to better our bodies? Like a lot of those things will ultimately help dizziness improve. The difficult part is getting yourself to do those things because you are maybe so uncomfortable because you are dizzy.
Yeah. Yeah, that's such a good point. Like obviously lifestyle is so key for a lot of the health conditions and issues that we talk about. But then if you have something like dizziness, which is debilitating your lifestyle, like how are you supposed to change your lifestyle to get rid of the dizziness? It's like a cycle. Yeah. And how disempowering that would feel to anybody, let alone a woman going through postpartum. Like that would be very, very hard. On these key lifestyle changes that you're talking about, without it being postpartum, just like, regular life, what would you say that you see really moves the needle the most for your patients, like out of the lifestyle factors?
Absolutely. So we know most people are chronically dehydrated. So I will say that that is one thing that is so hard. Like it feels so silly, but is so, so impactful because people who have no vestibular disorder whatsoever, no concussion, no nothing, who are high performing athletes. So these are like people who play Division I athletics, professional sports, things like that. When you dehydrate them, they perform as though they have a concussion or a vestibular disorder. And so then if you have a vestibular disorder, right, like that's going to make that worse. So that's one thing that like start today, drink more water, maybe have some electrolytes, consider that as well. But I kind of bring people through what I call the basics in my group program. The first of them is typically mindset because dizziness is so anxiety provoking and kind of getting you on a breathing schedule. And the reason that I find this to be so, so important is because your body needs to understand that you don't just do breathing exercises when you're already stressed out, when you're already feeling symptomatic, right? Because then your body is going to tie breathing and meditation to being symptomatic. And so you want, like when you're feeling like baseline or calm, even if you are dizzy 24/7, even if you want to be able to say, okay, I can breathe, I can feel okay, I can do exercise, things like that. Shifting the way you're thinking about your symptoms. So I am not afraid of this. I am not going to panic because I bring up my symptoms, things like that. That's really the mindset component. The next things we walk through are diet, how to balance your blood sugar, right? Eating enough protein, starting your morning with your breakfast with like 30 to 40 grams of protein and a glass of water. After that, going to exercise, which is something that I have a really hard time with a lot of people getting them to do, because you're like, I'm dizzy and moving my body makes me feel like junk. How am I supposed to move, right? Like moving my head makes me feel dizzy, awful. But ultimately, it is one of the most preventative things for migraine and vestibular migraine and chronic dizziness. And so we take you through like basic classes. We have classes every day for that, but kind of moving your body in a safe and controlled way. Again, hydration and blood sugar regulation, mindset. Those are like the biggest things. And then of course we go into sleep and things of that nature as well. But if you can kind of get down those lifestyle things that are so hard, right? Like I was just talking to someone who does really well with this disorder, who she was like, yeah, I do all these things, but like they're legitimately difficult. Like I have 2 kids, I'm trying to work, and like sometimes I don't sleep through the night. Sometimes I don't have time to take my supplements. Sometimes I do forget to do my neuromodulation device or whatever. Sometimes I do forget to meditate and breathe, and my symptoms do tick up. And that can be really frustrating because a lot of us don't have to live that way, even though we probably should.
Yeah, I think it makes a lot of sense. Yeah, it's funny, I talk to people who work in all sorts of health fields, and so many times it comes back to these like basic health principles that set the foundation before we can look at like very specific things that can kind of help, supplements, medication, something like that. It's always like sleep, stress management, nutrition, hydration, exercise, like these things. And it's interesting that happens so often. Is like, I guess it's not like sexy. Like people you can't really like sell it. You know what I mean? Like it's just kind of boring if you tell someone like, yeah, you should probably move your body every day. And people just kind of like roll their eyes, but, and then there's so much hesitation towards it. And there's so much like comfort in not doing those things. So like with nutrition, food is so convenient now that we could just like eat junk all day if we wanted to. We can get it delivered to our house. Like it's so accessible. So maybe that's why now, like, over and over again, we just educate on these basic principles is like, guys, like we got to get this down. But it's almost like society has just made it so much harder for all of us to do it all the time.
Absolutely. And I 100% agree. So when people have a chronic condition, which the population of the world is getting sicker and sicker and sicker, right? Like we are getting more inflamed, more chronic illness, like all of the things. And ultimately, I think that we can kind of drive it down to a couple components. We don't move our bodies as much. We almost never go outside. I think 90% of the time you spend outside happens before you're like the age of 12 or something. We never go outside. We don't see the light. We don't eat good whole foods. The things that are convenient are prepackaged and processed, right? The cleaning supplies on our shelves are not good for us. There are all of these things that ultimately add up together to make us less healthy. So even if you are, like I've had some people be like, I'm the healthiest I've ever been. I'm eating whole foods. I'm exercising. I'm doing all the things, but it's stressing me out, right? I have no time to think about anything else. That can drive chronic illness. And whatever it is that you are epigenetically predisposed to is ultimately what's going to get triggered, right? Like some people are genetically predisposed to Hashimoto's disease. I have an autoimmune thyroid disorder that has been triggered since I was probably about 16. And it's likely some environmental trigger, even though my whole family has that triggered it in my body. Like your body doesn't make mistakes. And when you have vestibular migraine or migraine, there is a genetic component. We don't know the exact gene. There are so many. So someone is going to come for me and be like, but I don't have the gene. We don't know all the genes, but we do know that it's genetically predisposed. And these environmental changes, these lifestyle changes that are not necessarily the most positive, ultimately are kind of what are triggering these things, if that makes sense. And that is really frustrating. That's really terrifying. And so these basics, just like you're saying, are the thing that over and over and over again, you're going to hear, and if you're not doing them, actually are going to make a difference. And then you can't supplement yourself out of bad sleep. You can't supplement yourself out of a diet. You can't kind of dig yourself out of these holes with these easy, quick fixes. Like medications, they exist for migraine, right? But they're usually not a magic bullet. And if your gut health isn't great, then they're not going to work as well as they should. So people have been like, well, none of these meds worked and I've tried like 15 of them. How is your gut health and how are you sleeping? Because if you don't have those things locked down, it's just not going to work as well. And so we really need to kind of get these lifestyle factors before we add in the other things. And sometimes you have to do it backwards to create space. And I understand that, but you really need to do them.
Yep, I totally agree. It's the low-hanging fruit, and it's the annoying thing with it as well. And like, I completely agree with this, is like, you have to do it every day, or like almost every day. Like I wish it was like, oh, I drank a bunch of water a few days ago, so I'm good. Like, but that's the hard part. It's like, okay, every day I'm like, well, here I am filtering my water, filling up my water bottle again. Like, and same with the nutrition. And every time I make a meal, I look at what I'm making. I'm like, okay, like, where's the fat? Where's the protein? Like, is this processed food? And yeah, it's the struggle is like the consistency, really. And then people argue like everything in balance, moderation, and 80-20. And, people have their own philosophies and stuff, but overall, you want the majority of your decisions to be like in favor of your health. And that's what people struggle with, is like the day in and day out, and it's boring and it sucks. Sometimes it's expensive and sometimes it's a lot of work. But the flip side is like, usually you feel better, you look better, you live longer, and you have less conditions. So it's tough. Is there a point where, and I don't know if you can even do this, but like, do you recommend people take medication for these issues? Or is that like something that, we try the holistic approach first and then see what happens?
I really think it depends on you as a person and knowing yourself. I am never going to medication shame anyone. And in fact, everyone with migraine who exists on this planet needs an acute treatment. And whether that is like a neuromodulation device, which I have a podcast about that you can go listen to. We do not have time for that today. Or it's a medication or whatever. You need something that will abort that attack, because migraine gone untreated will get more chronic. So we can kind of separate migraine from episodic to chronic. And this is not just vestibular migraine. This is migraine across the board as a disorder or as a disease. And migraine, it's like a feed forward mechanism. So if you have one attack, you're likely to have another one, another one, another one. And so if it is not treated and stopped in its tracks, which is the importance of having a medication on board, that I always do recommend having something that works for you, then it can get worse. So that's the first thing. Now, a lot of people are like, well, I literally can't exercise. I can't leave the house. I can't breathe hardly. I'm like, forget trying to change my mindset. Like, are you kidding me? This is terrifying. And so in order to create space, a lot of times I do have people start with medication. Now, does that mean you have to be on that forever? Not necessarily, but for some people, yes, it really is person dependent, because your ultimate goal is not to cure migraine. There are no cures at this point. I hope I lose my job one day and that there are cures. Like, that is my best case scenario. But at this point, there aren't. So how do we manage this? You basically need to build yourself a bigger bucket. So if you imagine like 2 cups that you might have in your house, one's like an 8-ounce cup, one's like a 16-ounce cup, right? And so you have 2 different sizes. If you're currently dealing with this 8-ounce cup, triggers are going in there all day, every day, and overflowing, triggering a migraine attack. Now, you have migraine, I should say, is a 24/7 disease that happens all the time. But the acute attacks are like what we would think about as like a migraine attack, similar to how someone who has asthma always has asthma, but is not always in an attack, right? So how big is that bucket? Is it 8 ounces or is it 16 ounces? Sometimes starting with a medication will build your bucket to be that 16-ounce bucket. So you can say, okay, now I have room. I have created myself space to be able to focus on my lifestyle changes. And that can be really, really, really important for a lot of people. And ultimately what can be helpful to help you wean off of these medications. And so for some people, the answer is yes. For the other people, the answer is no. But it really is going to be person dependent. And I know a lot of people also have tried every medication in the book and they're like, it just doesn't work for me. And in that case, you just have to start with one thing. Like, I recommend doing this slowly. Please, overnight, do not start drinking half your body weight in ounces and eating a bunch of protein and sleeping well and all the things, because it's not sustainable, right? Your brain is at some point going to be like, this is exhausting. I can't do this anymore. So add the water first, or add the breathing first, or add like whatever is the lowest hanging, easiest fruit for you, and build from there.
If there's one mineral you should be worried about not getting enough of, it's magnesium. Magnesium is the body's master mineral. It's powerful, and it's involved in over 600 critical reactions, including hormone balance, stress management, sleep quality. Even digestion is influenced by the presence of magnesium. But there are two big problems here. One, magnesium has been largely missing from U.S. soil since the 1950s, which explains why it's estimated that up to 75% of the population may be deficient. And two, most supplements contain only 1 or 2 forms of magnesium, when in reality, your body needs 7. The only magnesium supplement on the market that has the full spectrum of all 7 forms is called Magnesium Breakthrough by Bioptimizers. This is my favorite. I've been taking it for over 2 years. That's why I'm so excited to tell you that I was able to arrange a killer deal for you for this summer. You won't find this deal on Amazon or even on the company's own website. This deal is exclusively for my audience, and it's for a very, very limited time and only while supplies last. So right now you can actually get a bottle of Magnesium Breakthrough for free. Like, actually, you get it for free. I'm not kidding. So go now to my website that they made for me, which is magbreakthrough.com/biohackingbrittanyfree, and get your bottle of Magnesium Breakthrough for free today. Again, that's magbreakthrough.com/biohackingbrittanyfree, and you get it for free. So go now. It's linked in my show notes of this episode, and it's linked on my website, so you can find it really easily, or just DM me and I will send it to you as well. All of us should be on magnesium, and this is my absolute favorite one to take. Yeah, I love that. I definitely agree with that. I'm curious what you think about, I was just thinking my husband gets headaches every now and then, and it's so interesting because I'm a nutritionist, so I always think it's like related to his gut health, and he eats crappy, and then 2 days later he has this headache. It's almost like clockwork now, and he'll take things like Advil and it doesn't do anything, and he still takes the Advil, and I'm like, dude, it doesn't do anything. You're just messing up your gut. You don't need to take that. What is the difference, I guess, for someone like him? How would he know if this is actually a migraine pattern forming, or this is just a headache related to something else?
Yeah. So it really, ultimately, you need a headache specialist in order to diagnose that. But there are some differences. Typically, a migraine is going to be on one or both sides of your head, last from 4 to 72 hours, be mild, moderate, or severe, and sometimes reacts to over-the-counter medications. You might also have eye pain, cheek pain, jaw pain, tooth pain. That kind of ice pick kind of situation might also happen at the same time. We also need to remember, just for the audience and maybe your husband as well, that any sinusy headache is not a diagnosis. That is actually migraine. So sometimes it's migraine, but typically you'll have more light sensitivity, sound sensitivity, nausea, and other migrainous factors included in the headache rather than just the head pain by itself. That can be helpful. Does that make sense? There's extra symptoms on top of the headache, because migraine is way more than just a headache, whereas most people have experienced a headache at some point in their lives.
Yeah, absolutely. Yeah, I wonder if it might be a migraine then, because I just think about the things that he tells me. He's like, the pain is behind my eye. Usually he will go and lie down in a dark room, that type of thing. But it's interesting. There hasn't been any type of injury, or I just wonder what the cause would be for them to start showing up in the last couple of years. But yeah, I mean, seeing a specialist, I guess, is really the way to go.
Yeah, and I mean, a headache specialist can be a long wait to get into and all of the things, but I do think that it can be helpful, and anything can trigger it. Literally anything. You have a genetic predisposition to this disorder, and that is the cause of migraine. There is no like, well, I don't know, I got caused, I have mold toxicity or whatever. Like those things could add to your trigger load, but trigger is separate from cause, if that makes sense. So cause is I have a genetic predisposition to this disorder, and these things, whether it's mold or poor gut health or lack of exercise or not like great lifestyle factors or genetic, like some people have a lower like genetic bucket than other people. So that is the ultimate cause. Now the triggers, again, if he's eating junk food, right, and his gut health goes down and you're like, I know I'm a nutritionist, like please eat better food. And then you're like, it's like clockwork. It happens within 48 hours. That can typically be like related to migraine, and really taking those lifestyle considerations into your control and into your hands is really important, because you do want to kind of look out for that. And then when you have one parent who has migraine, there's a 50% chance that your child will have migraine. And if you have two parents with migraine, there's a 75% chance that your child will have migraine. And so looking out to see if you are a parent with migraine, like, oh, my child is telling me their brain hurts, or my child has colic as a baby, or they're vomiting and saying like, I have head pain, things of that nature, really bad stomach aches, constipation, things like that can be indicative that they're starting migraine at a really young age and need to be taken to the neurologist. So that's something I like to tell people. There's a great program called Migraine at School. I have no affiliation with them, but they are excellent. And it's kind of for pediatric migraine knowledge and education and things like that.
Yeah. Yeah. That makes a lot of sense though, like being genetically predisposed to it. And then, tapping into epigenetics is what you're talking about, of like, are we going to activate these genes to turn on and off? Okay. What's going to activate them to turn on is things that are inflammatory, drinking a lot of alcohol, eating crappy food, whatever, not sweating, all of these things. So it is, back to that lifestyle factor, which it tends to be the case there. And then it makes sense of like why Advil wouldn't do anything for it, right? Like, because if you look at the root cause, like, and it's a genetic issue, then what's Advil going to do? Nothing.
So for some people react well to Advil, but most people, I will say, like, don't. And you cannot, and I want everyone in the world to know this. If you take Advil or triptans, or there's one more class of medication, like really heavy duty painkillers that I can't remember their med class for whatever reason, more than 9 times a month, even combined. And a triptan is a migraine medication that's for acute attacks. More than 9 times every 30 days, you will end up with a rebound attack. So if you're taking Advil 3 days a week and you have migraine, even if it's for knee pain, that can drive more migraine attacks. So all of these things are related, and it is so, so, so important to understand that like the Advil isn't even working. Like, why am I taking it? Advil, Excedrin, Tylenol, like you name it, it's in that like OTC NSAID category, plus triptans, which are off like sumatriptan, things like that are prescribed for these conditions, cannot be taken alone or in combination with other ones more than 9 times a month.
Wow. That's crazy. For the genetic testing or like the genes related to the migraine, can you get a genetic test that shows you like, yes, you are predisposed to this?
You cannot. So there's a hemiplegic migraine gene that I will find for you that we do know. I think it's CACNA1A and then a couple other ones. There's 4 abnormal gene variants for hemiplegic migraine specifically, PRRT2, SCNI1A, and then ATP1A2. That's from a quick Google. But that is the only one we know, like that those genes are related. For other migraine variants, there are estimated to be thousands. So they don't know at this point. And it is, for how common it is the most underfunded disease that exists for its commonality, if that makes sense. So call your senators, basically. Make them fund it, at least in the States.
Yeah. Well, that's good to know. But yeah, that is really frustrating. Ugh. Hopefully that changes. I would love to see that kind of be added to something that we can start to test for and get more answers on. Yeah.
Absolutely.
If people want to work with you or reach out to you and they have more questions, where can they do that and how can they find you?
Absolutely. I am at the Vertigo Doctor, always spelled out everywhere. Instagram, TikTok, website, you name it. My email is madison@thevertigodoctor.com. I will say that is the least efficient way to reach me. my assistant will reply to you. But if you want to get to me fast, use Instagram. And then if you are interested at all in working with me, I do one-on-one in 6 different states in the US. And then I do coaching one-on-one for only members who are a member of my group program called Vestibular Group Fit, which you can find anywhere on my websites. It's thevertigodoctor.com/vestibular-group-fit if you want to go directly to that. And then if you are interested in inflammatory conditions and vestibular disorders at the same time, we are holding something called the Vestibular Virtual Summit in the fall, which we are very excited about, talking about mold, Lyme, and other inflammatory conditions and sensitivities, MCAS, histamine intolerance, and what that might have to do with your vestibular disorder. And then I have a podcast that's released weekly called Grounded, the Vestibular Podcast, that will have lots of information on there as well.
Amazing. Okay. I will link all of that in the show notes and on my website so everyone can find you. Thank you so much for this discussion. Honestly, I learned so much and it was just so helpful. And I think my audience definitely learned a lot as well.
Awesome. Thanks so much. And I also think I made you a discount code for 20% off group. That's Biohacking Brittany 20.
Perfect. Okay. I will add that as well to the show notes.
Thank you so much for having me.
Thanks for listening to another episode of Biohacking with Brittany. If you're interested in finding the show notes or the sponsors for this episode, you can do so on my website, which is biohackingbrittany.com. Remember to follow me on Instagram where I'm most active. My handle is @biohackingbrittany. And if you're interested in working together and you want to email me directly, you can do that. My email is info@biohackingbrittany.com. And I look forward to hearing from you and having you tune in next week.